Good afternoon, and thank you so much for the opportunity to be here with you this afternoon. I think it's very fair to say that over the course of the last few months, with pandemic, or with quarantining and shutdowns and loss of jobs and income, that hope has been a little thin on the ground for a lot of people. Fortunately, for over 70 years, our Lubbock Area United Way has been providing hope to those in need through its 23 community partner agencies. And through your support, hope starts here. I'd like to take a moment to tell you about one of those 23 partner agencies, and that is Health for Friends Clinic. For many, many years, there's been a significant number of our citizens that have not easily accessed health care. They have no money for health insurance. They can't qualify for programs like Medicaid or Medicare. And one of the most common factors that they share is chronic illness, high blood pressure, high cholesterol, morbid obesity, and primarily diabetes. Sadly, we have one of the highest death rates attributable to untreated diabetes in the state. That's the bad news. The good news is that those chronic illnesses can be controlled through self-management. And for over 30 years at our on-site clinic and at 17 outreach sites in 3 counties, Health for Friends Clinic has been providing free basic one-on-one education and free health screening to help these patients self-manage that disease process. The need is even greater for our services at this point because, as I mentioned earlier, with job loss also comes benefit loss, such as health insurance. You may not know this, but the annual direct medical costs for untreated diabetes in Lubbock County runs into millions of dollars in ER visits, in hospital stays, dialysis treatment, when kidney failure occurs, just to name a few. University Medical Center, our county hospital, did a study, and they projected that over 50% of the patients they would treat in a 12-month period would be diabetic. They also projected in this study that at least 16% of the patients that they would treat in that same 12-month period would be unfunded. You think of how many people come through that hospital for treatment each year. That means that we all become responsible for that 16% in costs. So each time that our nurses are successful in educating those patients on self-management and helping them to make those necessary lifestyle changes, we're giving that patient, number one, the best opportunity to live a longer and healthier life. When we're successful in that, then that means we're also successful in helping them stay out of those ERs and the hospital beds and the dialysis centers, and then we win as a community as well. Because of United Way, we were able to provide help for Diane. Diane had worked for many years in a prestigious organization here locally until her diabetes just got the best of her and she could no longer do her job. And with the loss of her job, meant loss of benefits. Luckily, she found Health for Friends, and we were able to provide those necessary resources to help her get her diabetes under control and help her get back on track. Because of United Way, we were able to help the migrant family that sat down across from one of our nurses at an outreach site. They had not seen a doctor in over 10 years because they had no means to do so. All 3 of them had glucose levels above 300. The ideal fasting glucose rate is 110 to 130. We were able to get them in to see a doctor and get things under control. And because of United Way and supporters just like you, we were able to help Joe, who came this close to losing his life to diabetes, and he wasn't even aware that he had it. So on behalf of the Lubbock Area United Way, its 23 community partner agencies, and those many, many lives you touch through your giving, please know that you have our utmost gratitude. And because of all of you, hope starts here. Thank you.